How are you? And trust you're doing great. Today, what the encouragement or the push I'm giving you is to have a follow-up checkup. So what is a follow-up checkup? So initially, when we advise people to go for checkup, right, and they've done that certain checkup, and it is very important or advisable that you have a follow-up checkup, right? So it depends on what you are treating or what the diagnosis is all about. But if you really want to prioritize self-care, right? Self-care activities, you really want to understand how your body works, you want to understand how your system, and you want to know your values, you need to also include a follow-up checkup in your routines. For instance, um, checking your blood pressure. Let's assume you've checked your blood pressure for the first time and you do not have high blood pressure, like you're a non-hypertensive person. So you checked for the first time. Even if your blood pressure is not high or you're not living with high blood pressure or hypertension, it is very important that you check. Checking regularly helps you to detect when things are going wrong, right? It also helps you to know your value, like ascertain that, oh, this is my range, and it helps you to be confident about your health, monitor your health. For instance, someone like me, I kept telling people that I know my numbers, especially for my blood pressure. I know when it is high, I know when I'm stressed, because once it crosses particular value, right, range, it is an indicator of stress for me. So having a regular follow-up checkup is very important. Most times when we talk about prioritizing self-care, we always reach out to people, to clients, to tell them about, oh, have you had a follow-up checkup done? Most people, right, forget that it is necessary for them to have a follow-up checkup. Some will tell you, oh, since last year I have not had any follow-up checkup done. Some will also tell you, oh, I have not done it. Is there any need for me to do it? Yes, today in this video I'm telling you that there is a need for you to always have a follow-up checkup done. Your blood pressure after your first check, it's important that you do it again. If you're not living with high blood pressure, you can prioritize having it done every 2 weeks, or at least once a month. Like, you just once a month, that you're not trying at all. Don't stay 3 months without checking your blood pressure. I know in some articles, right, or some people, some might even tell you maybe once a year. No, as a health coach, working closely with clients to help them adopt a healthy lifestyle, it is important that you check your blood pressure at least once a month, a month. Once you start checking once a month, it helps you to master your system, master your number. And once you start checking once a month, before you know it, you start checking bi-weekly, and before you know, you can even get the equipment at home and you check it daily. It's possible for you to check your blood pressure daily or 3 times a week. So if you are living with high blood pressure or hypertension, right, if you know you are living with, you check more often or more regular, like 3 times a week on average, if you're not checking every day. And imagine, checking every day is actually fun. If you have the metric, your blood apparatus at home, checking every day is fun. Imagine including blood pressure check, into your routine, daily routine. It diverts your mind from every other um, activities. It makes you know that, oh, you're focusing on your health, right? So if you're living with high blood pressure or hypertension, you check and you have the metrics at home, your BP apparatus at home, try and get one. So you check 3 times a week. Make it habits, like make it a routine, 3 times a week. Don't stay a week without checking, like a week without checking. Yes, and just make it gradually. If you can start with once a week, then you increase it with time. So, but there is a need for close monitoring. Follow-up checkup creates room for close monitoring, and it raises signals like if there is any need for you to take action. So your sugar level as well needs a follow-up metrics, like follow-up checkup, checking, let's say once in 6 months, twice a year, right? It's okay for you to check if you're not living with any of maybe diabetes or so, just for you to keep yourself in check. Then if your sugar level is high, you can always check regularly. If you're living with diabetes, you should check more often, let's say every other day, depending on how your treatment plan is, right? Every other day you should check if you're not checking daily. So your treatment plan helps you to know how often you need to check. But if you're not living with diabetes or high increase in sugar level, you should check at least, let's say once in 3 months. It's okay, it's reasonable for you to check once in 3 months, and let's say twice a year. That's fine. Your weight also needs a regular checkup. You will be able to monitor what you have had. Like today, I just checked my weight and I realized that, oh, I have added another 2 kg, though it's still within a normal range for me, but it helps me know that, oh, I've added 2 kg, and I'm logging it, keeping that record. So your weight also needs to be checked. Some people in 10 years you've not checked your weight, you don't know what your weight was in the last 10 to 7 years, 5 years, even last year. So these are things you should check regularly. It helps you it gives you plan to what you need to do next. Also, what else needs a follow-up checkup? Height doesn't change, right? If you are an adult, your height doesn't change, but checking it regularly helps you to know that, oh, this is it. I know my height. My height is 1.67, and that has been regular. So, but for children, you might want to check their follow-up, do it regularly for them, just to you to know, oh, what's my baby's height or what's my child's height. So that's also a good thing to do. What else? Other blood routine tests, like what other blood routine tests needs follow-up checkup. Probably you just treated infection, right? For people who are treating probably urinary tract infection, any form of infection, you should also do a follow-up checkup. Yes, test after you might have done it. If you have the resources available, that is good for you. You know, other viral tests like other tests like syphilis. If you have had the what's it called, the history of that, or other things like HIV, hepatitis. For pregnant women, follow-up checkup, blood pressure, weight, sugar level is something you will do continuously, and also urinalysis is something you will do within the period of the antenatal period, 9 months. So urinalysis is something you will check regularly. If you're not checking at your facility, it's important to draw your doctor's attention to that. So what else needs follow-up checkup? You can put that into the comment section, right? Or just comment on other things that need follow-up checkup. Follow-up checkup is very, very important. It helps you understand how your system works. For those of us as well who are living with, let's say, reproductive health issues, follow-up checkup is needed. Just like even people who are having access to mental health management, like stress level, you need a follow-up checkup, right? The more you check, the more you get to understand your system better. I hope this piece or information is useful. Thank you, and see you some other time. I remain your health coach, your nurse health coach, Blessing Raji. Nurse-Raji. Bye.